Today we will discuss bronchiolitis, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Bronchiolitis is an infection or inflammation of the small air passages in the lungs called bronchioles. It's most common in babies and young children, but can occur in adults as well. Here's a simple breakdown. What causes bronchiolitis? Viral infections, most often caused by viruses, particularly the respiratory syncytial virus, RSV. Cold weather. It tends to happen more in the fall and winter months. If you or your child has bronchiolitis, you might notice coughing, a persistent cough that can be dry or produce mucus; wheezing, a whistling sound when breathing, especially when exhaling; shortness of breath, difficulty breathing or feeling like you can't catch your breath; rapid breathing, breathing that is faster than normal; fever, mild fever may accompany the illness; fatigue, feeling unusually tired or lethargic. When to seek help? You should see a doctor if you notice difficulty breathing or wheezing that doesn't improve; signs of dehydration, like dry mouth or not urinating; high fever or worsening symptoms. Early intervention can help manage the symptoms and prevent complications, especially in young children. If someone has bronchiolitis, here are some simple steps to take. 1. Stay calm. Keep the person calm. Anxiety can make breathing harder. 2. Keep hydrated. Encourage them to drink plenty of fluids, water, soup, etc. to stay hydrated. 3. Rest. Make sure they get plenty of rest to help their body heal. 4. Use a humidifier. A humidifier can add moisture to the air, making breathing easier. 5. Control fever. If they have a fever, you can give them over-the-counter fever reducers like acetaminophen Tylenol or ibuprofen Advil if appropriate. 6. Monitor breathing. Keep an eye on their breathing. If it gets harder or faster, seek medical help. Avoid smoke. Keep the environment smoke-free, as smoke can irritate the lungs. 8. Follow doctor's advice. If a doctor prescribes medication or recommends specific treatments, make sure to follow those instructions. If symptoms worsen or don't improve, it's important to contact a healthcare provider. In the hospital, if someone has bronchiolitis, the medical team might do the following. 1. Monitoring. They will keep a close eye on the person's breathing and heart rate. 2. Oxygen therapy. If breathing is difficult, they may give oxygen to help them breathe easier. 3. Fluids. They might provide IV fluids to keep the person hydrated, especially if they can't drink enough. 4. Medications. They may give medications to help open the airways or reduce inflammation. 5. Suctioning. If there's a lot of mucus, they might use a suction device to clear it from the airways. 6. Nebulizer treatments. They might use a nebulizer to deliver medication directly into the lungs to help with breathing. 7. Education. They will provide guidance on how to care for the person after leaving the hospital. The goal is to help the person breathe better and recover from the infection. For bronchiolitis, the medications most commonly used include 1. Bronchodilators, albuterol, Ventolin, Proventil. This is often given through a nebulizer to help open the airways. 2. Corticosteroids, dexamethasone, sometimes used to reduce inflammation, especially in severe cases. 3. Antipyretics for fever, acetaminophen, Tylenol, to reduce fever and relieve discomfort. Ibuprofen, Advil, Motrin, another option for fever and pain relief, not recommended for infants under 6 months. Hydration, I4 fluids, if the patient is dehydrated or unable to drink enough fluids. These medications are typically prescribed based on the severity of the condition and the specific needs of the patient. Always consult a healthcare provider for appropriate treatment. Certain groups of people are more likely to get bronchiolitis. 1. Babies and young children. Kids under 2 years old are most at risk because their airways are smaller and still developing. 2. Premature infants. Babies born early may have weaker lungs and immune systems. 3. Children with underlying health issues. Kids with conditions like asthma, heart problems, or other lung diseases are more vulnerable. 4. Exposure to smoke. Children who are around tobacco smoke have a higher risk of respiratory issues. 5. Crowded environments. Kids who are in daycare or around a lot of other children may be more likely to catch viruses that cause bronchiolitis. 6. Winter months. The risk increases during the colder months when respiratory viruses are more common. These factors can make it easier for bronchiolitis to develop if someone gets a virus. Now you need to watch my video on alcohol withdrawal or have a look at seizures.